Thank you very much for your time this morning, Dr. Candice Groenewald. It's a difficult balancing act that women are faced with because COVID-19 is here to stay, and the new sets of normals that we've set over the last 2 years are likely going to remain with us for the foreseeable future.
Yes, no, I agree, and thank you so much for having me. This is such an important topic to talk about, and it's important that we as females talk about this issue. As you said, that women has been affected disproportionately by this pandemic. And I think that the issue of this is that it's not just about the socio-economic impact of the pandemic, but the social and familial roles that we play as women within our societies. And within the pandemic, that has increased and enhanced quite significantly for us as females because we took on, like you said, more caregiving roles. But often the caregiving roles is not only related to childcare, right? So as women, caregiving roles in relation to caring for families, siblings, elderly parents, and elder mothers might be caring for grandchildren. So it's quite a diverse impact that it's had on females in our society, and it's something that we need to be thinking about. How do we support women to be able to cope better during this time? Especially in light of the fact that, like you said before, we've seen majority of the people who were unemployed during the lockdown or during the pandemic in the last 2 years were women. Majority of the people who lost their jobs were women. Women were relatively more likely to suffer from hunger and food insecurity during the lockdown. And yet, what we also saw during this time was that you would remember when the social relief of the stress grant became available, more men than women accessed this grant. And one particular reason for that was because many more women than men had access to the child support grant. And you were not able to hold two of these grants at the same time. And so even though there's been strides made and women are able to, or people who have access to the child support grant can now also access the social relief of the stress grant, it still gets us to think about how the impact of this pandemic for women and how we need to support women in a different way than we do men within the society. So, as you have said, the pandemic is here to stay, and how do we think differently about the roles of women and recognizing and prioritizing the roles of women within our society is an important question for us as researchers, as interventionists, as academics, as scholars, as policymakers, as various stakeholders. We have to think critically about these issues.
Yeah, I want to get into the issue of support and support structures, but before we do, Candice, just to stick to the theme that you brought up in the end there in terms of how we learn how to think about the roles that women play in society, a big component of this are the stereotypes that exist about the role of a woman, many of which we've been unable to come out of. So when we're talking about rethinking the role that a woman must play, it needs to be a societal effort so that those stereotypes and those norms can be broken down.
Yes, and I think that in doing that, we have to... The one thing that I've learned about the pandemic, and I think many researchers would agree, is that it forced us to think about how do we do our work differently. And how do we use the platforms that we have available to do our work right now? And what you're talking about is changing societal norms. And if we had an opportunity to do that very quickly, there would be so many things that we could address right now. But changing social norms, and our social norms is related to our cultural, our religious norms, our traditional norms. And so changing that is long-term, but the fact that it's long-term doesn't mean we shouldn't start, right? And so there are so many different platforms, which I think different organizations and individuals have used these different platforms to try and give voice to the fact that we are not just women to be at home and child bearers, but that there's so many different components to what it means to be a woman in society today. But I think we need to use these different platforms in more innovative ways to tell the stories of who we are as women, who we want to be as women, who we can be as women, who we are not. Because that's important in order for us to change the narratives around what it means to be women in South Africa today. And we have to be talking about these issues. We have to, and I'm not just talking about on this kind of platform, we need to be speaking about it within our groups when we have conversations. We need to be speaking about it on our social media platforms. We need to be speaking about it in our churches, in our different spaces, because it is within these macro level platforms that these different societal norms develop. And if we want to challenge that, it's at that level that we need to challenge these perspectives around what it means to.
Yeah, and then earlier on you spoke about women needing to be supported as they deal with this new norm of the pandemic. How do we do that? Are there support structures that exist within our society to at least give a woman a platform to adjust to the way that we live now?
I think it is within the hands of societies and the different stakeholders within societies to think differently about and support the different roles that women play. I think that within, for example, myself, I'm a woman. I work. I'm currently working from home, and so we've been trying to engage as what does it mean to support women and parents in general. And adults in general to be able to work well at home, recognizing that there's all these other responsibilities that come with working from home during the pandemic. And so I think that it's about, if we create a narrative around what it means and the challenges that we face as women, and using that narrative to inform the way that different stakeholders think about women, then we will be able to understand how we can support women within our societies. And I mean, it's not just about implementing these large-scale interventions to support women, but it is about being respectful about that women have responsibilities at home. Being flexible, for example, for women who work. If women, for example, whether you are someone that is traveling to work on a daily basis, but you have to go and drop your child at school, you have to collect your child at a certain time, you have to be home to do other domestic responsibilities, you have to care for an elderly person within this pandemic. All of those things happen at the same time. And so if we want to support our women and keep them within the labor market, keep them flourishing, keep us all going during this time and ensuring that our well-being as well, we need to think about, okay, how do we do this in a way that this person can go and drop their child and be at work at the same time, at a different time, in order to give them the flexibility to be able to address all these different roles. Because like you said, the pandemic is here. It's been here for 2 years. We've made significant strides in understanding people's lives during this time, but there's still so much more to come. And what we're learning about the pandemic is also how we can support people during, even post-pandemic, God willing, that will be soon. But we're learning about what are the support structures that we need to be put in place in order to do that. But we have to just keep our eyes on the ground and really listen to and observe the lives of people at the moment. And I think just on that point also is to recognize that everyone's experiences are not the same. And so we are very good in South Africa in many ways to adopt strategies and interventions and programs that are internationally renowned. But what we have to recognize is that South Africa is a beautiful, diverse society that has so many different forms of what it means to be woman, even within our country. And so when we do think about supporting, we need to think about the woman that is working, the woman that is not working and looking for a job, the woman that is not working and looking for a job but also caring for 3 children at home, and an elderly person, the woman that's working with no children at home, the woman that's working with supporting other children at home. So I think what I'm saying is that there's a need at this moment to get our minds and collective think tanks together about how do we support women, bringing different research, together now to think about how do we do this differently.
No, absolutely. Thank you very much for your insights there, Dr. Candice Groenewald, giving us a sense of the hardships that women in particular have had to face during the pandemic and, of course, how to change that spectrum.